Very good evening, friends. Meeting after a big gap of many days in between in this Materia Medica session also. So, Happy New Year to all of you. And we're going to learn few remedies remaining from the second year syllabus. One of the remedy, again from the biochemic system of medicine, is Ferrum Phosphoricum. I will going to share my experiences with Ferrum Phosphoricum, and then I will teach the first important two paragraphs of the Boric's Materia Medica. See, understand the Ferrum Phosphoricum first. Whenever you have to learn the Ferrum Phosphoricum, keep it in your mind. The first stage of all inflammation is Ferrum Phosphoricum, according to the Sussler salts. So, Sussler says it is the first stage of inflammation. So, what is the first stage of inflammation? The first stage of inflammation is congestion, increased blood supply to the part, the redness of the parts, the heat of the part is the first stage of inflammation. And that first stage of inflammation is the specific action of the ferrum phosphoric. But you have to catch what exactly the stage is. There are many remedies in between. You have to understand the stages. When the patient comes to you in an acute agony with a very severe pain, doctor, I'm having very severe pain in my tooth and he's in agony, please do something, please. And he says, doctor, I will going to die. He is in such a state, and you observe that teeth is not at all swollen. There is no inflammation, there is no congestion. It is the stage of inflammation where congestion has yet to start, is the state of aconite. Thereafter, after the pain develops, thereafter the stage develops where the congestion starts appearing but not fully blown, but in part becomes red. The inflammation starts increasing, is the stage of Ferrum Phosphoricum. And then comes fully congested stage of a belladonna. These are three important stages in the first stage of inflammation. So first is aconite, in between is Ferrum Phosphoricum, then is belladonna, and after belladonna, once the congestive stage is settled and it becomes toxic, dull, the redness turns into a dark redness, brownish little bit or dark red color appears to be there, and patient starts becoming dull and dizzy, looking toxic, is the state of gelsemium. First stage of inflammation, these are the in-between stages, in-between stations, which you have to catch. So this is the remedy which you should have in hands with yourself as well as all of your patients. Ask the patients whenever they have any problem, whatever it may be, in early phase, if it is not an aconite stage, and aconite is the remedy which will going to work if the state of aconite is present. But if it is not aconite, aconite will not going to produce any change. But Ferum Phos is the remedy which you can use in 6x potency, that is semi-dynamic doses. And when you utilize Sussler's salt, it fulfills the molecular deficiency and works very fast. So Ferrum Phos is the remedy which I used to use very commonly in order to stop the any inflammatory reaction at the earliest level. It settles the pain, it settles the redness. If patient comes, doctor, I'm having very severe earache since morning. You observe there is little bit redness, give the Ferrum Phos, that's all. Ferrum Phos 6x repeated for 5 days, tedious. This is very important remedy in such types of cases. Acute toothache, patient comes, doctor, I'm having very severe toothache since morning. Acute toothache, where pain is associated with little bit inflammation. The first stage, a remedy is Ferrum Phosphoricum. And every time, whenever you are going to prescribe remedy, make it sure that you should use it in 6x potency in such types of cases when you are using it on the pathological basis. So this inflammation, wherever it may be, whether it is eye pain, whether it is neuralgic pain, whether it is toothache, whether there is rhinitis, whether there is sinusitis, where there is a gastritis in acute stage, urethritis in first stage of inflammation, this remedy makes the difference. And this is the first weapon we should keep with ourselves to fight against such a thing, and give it to your friends, give it to your all patients, keep their one bottle and ask them, if you have fever, start with Ferrum Phos 6x. Because otherwise, if they don't have such a thing, they consumes the crocin, they consumes the paracetamol, nimesulide, ibuprofen, then natural reactions get disturbed. And once natural reactions get disturbed, then giving a homeopathic remedy aggravates the condition. It is always better if they have Ferrum Phos with them, ask them to start Ferrum Phos, meet me tomorrow. It is such a wonderful remedy in acute stage of any disorder, specifically for the febrile illnesses. One should have Ferrum Phos with them. Ask them to continue. Repeat it 2 hourly, 3 hourly. It doesn't cause any trouble. Ferrum Phos 6x, that is the potency one should keep with them. And not only for fever, with every inflammation. So, fixed in your mind, there are 4 remedies for the first stage of inflammation. With pain, acute agony, aconite, followed by Ferrum Phos stage, where the pain is associated with early redness. When fully congested, absolute redness, third part is the belladonna. And when it goes beyond becoming dark red, dusky is the proper word for it, and patient becomes dull, drowsy, dizzy, Zelsemi. This is a minor understanding of the pathogenesis of the remedy. And this is one has to clinically verify. If you make a habit of looking towards the patient with the pathological view, you can catch them very easily and you can prescribe very easily. My suggestion to all of you is to learn this clinical aspect. Don't go only with the functional symptoms and don't go only with the mind. If you are able to judge the remedy on the basis of these pathological signs, you are able to catch the very perfect remedy. Ferum Phos is the remedy for this stage of inflammation. Now let us read it from Boric's Materia Medica. Only first 2 paragraphs where we'll going to read and we'll go with directly with the relation. In between part, it is homework for you, because in every part, in the next remaining part, you'll get one sentence. First stage of inflammation in head, first stage of inflammation in eyes, first stage of inflammation in nose. Everywhere you'll get this sentence. I don't want to that go with that. I want to explain you the core of the remedy and what Boric wants to explain regarding this. We'll start with the Boric's Materia Medica. Ferrum Phosphoricum, the phosphate of iron. If you want to read this from Susler's Materia Medica, go with my lectures on the YouTube in the playlist of biochemic remedies and open the Ferrum Phosphoricum and learn the Ferrum Phos. You're going to learn all the aspects. So this is very important thing one must do. Shahrukh has asked one question, sir, if we have given internal medicine, then if at all biochemic medicine is needed, since both act different planes, then can we given different remedies at the same time, sir? Yes, it is an adjuvant to the homeopathic remedy many times. If your remedy is wrong by any means and if it is not working, but this remedy, Ferrum Phos, if it is there in such types of condition, whatever I already discussed, then it supports your remedy. So supports your main remedy. It is the remedy which will work very fast because it is in semi-dynamic doses, not purely material, not purely dynamic. And when semi-material means a molecular level, it works very fast. And that's why I used to, in my whole practice is based upon these biochemics, and that's why I get the results very early in my practice. So it is a good adjuvant. Ferrum Phosphoricum, in the early stages of febrile conditions, it stands midway between the sthenic activity of aconite and belladonna and the asthenic sluggishness of torpidity of the gelsemium. So my suggestion is that it is aconite followed by Ferrum Phos, followed by belladonna, followed by gelsemium. It is not aconite, belladonna and Ferrum Phos. Aconite, Ferrum Phos, belladonna, gelsemium. The typical Ferrum Phosphoricum subject is not full-blooded and robust, but nervous, sensitive, anemic with false plethora, easy flushing of ferrum. See, this is very important. You get the false plethora in ferrum mate also and ferrum phos also. False plethora. False plethora means it looks red, but there is actually anemia. Patient is anemic, but the face looks flushed. This is false plethora, and ferrum phos, ferrum metallicum, this is very characteristic symptom. Ferum Phos is the remedy which takes part in the formation of hemoglobin molecule. Susler has very nicely explained the physiology between these, and he explained Ferum Phos alone is not able to produce hemoglobin molecule. It requires three salts to come together to form the hemoglobin molecule. The Ferum Phos, the Calcarea Phos, and natrium. These three comes together, and then hemoglobin molecule is formed. He has very nicely mentioned in his biochemical. And that's why if you want to treat the anemia, better is to give these three, or better is to give the biocombination one where all three comes together. Biocombination number one is anemia. And you can use, yes, I am using it many times. Wherever the patient is continuously on iron tonics and he is not improving, this is good boost, and it works so fast that just now I have checked it. One of my patient last month had the hemoglobin about 7.8, and today after one and a half months when I checked, it is 10.2. This is because it works so nicely. If you give material iron, it will increase hemoglobin after every month only by 1 gram. But with this, it works very fast. And that's why it is a good remedy to be considered over there. These are robust, not robust, but nervous sensitive. They're nervous. Nervous means on the tip of their nerves, sensitive. Anemic with false plethora and easy flushing of ferrum. Prostration is marked. Exhaustion. Prostration is marked. Face is more active than gelsemium. This is very important. Gelsemium, there is dullness, slowness, sluggishness, dizziness. Gelsemium is the toxic state of inflammation. Ferum Phos is the active stage of inflammation. The superficial redness never assumes the dusky hue of gelsemium. See, dusky word, very important. That indicates the toxicity on the face. It is not fully blown plethora. It is a dusky, dull red. Pulse is soft and flowing, not anxious restlessness of aconite. See, here again one difference he has mentioned, and that is very typical. When aconite comes, his pulse is full bounded. It is full bounded pulse you can get, and patient is in turmoil with pains. Ferrum Phos is not like that. Here the pulse is normal, pulse is soft. It is not highly increased like aconite. So you have to understand this pathological and clinical correlation of the remedy so that you can catch. Pulse is soft and flowing, not anxious restlessness of aconite, susceptibility to chest troubles. So patient is very susceptible to chest where the bronchitis is very common. Bronchitis of young children. In acute exacerbation of tuberculosis, a fine palliative wonderful power. So in case of tuberculosis, where inflammation is settled over there, the consolidation stage is there, and the inflammation starts increasing. This is one remedy which is very useful in such types of stages, in early stages of tuberculosis. Corresponds to Gravel's oxygenoid constitution. There are three constitutions. Already we have discussed about the constitutions earlier also. the carbonitrogen constitution, very close to miasm sora. Then second is psychotic miasm, closely related with hydrogenoid constitution. Oxygenoid is related with the syphilitic. And when you talk about Ferrum Phos over here, even though it is indicated in first stage of inflammation, miasm covered over there is the syphilitic, oxygenoid constitution. One question me, sir, how can it be the oxygen? We call it as a life force, and still how it is a syphilitic. If you'll understand the pathology, the free oxygen radicals which moves inside your body destruct the cells. That's why in allopathy or modern science, they use the antioxidants, which blocks those free oxygen radicals over there, and because of which the destruction is prevented. So destruction is caused by the free oxygen over there, and that's why oxygenide constitution also has the destruction over there, syphilitic miasm. So see, carbonitrogenide, SORA, hydrogenide, psychotic, and oxygenide is the syphilitic miasm. Corresponds to Graval's oxygenide constitution, the inflammatory, febrile, emaciating, vesting, consumptive. Consumption means tuberculosis. This word comes in whenever in Materia Medica or in homeopathy. It is direct translation of Kshay Rog into consumption. Consumption is consumption of energy. Tuberculosis is the disease where there is a consumption of energy and person becomes emaciated. Ferrum Phos is one of the important remedy. So don't consider Ferrum Phos is a superficial acting remedy. No, Ferrum Phos is a deep acting remedy. It is a remedy which covers the tubercular miasm, which covers the syphilitic miasm. So even though you are using it in acute stage, but when the destruction is used to happen over there, think about Ferrum Phos. The remedy for first stage of all febrile disturbances and inflammation before exudation sets in. Exudation sets in means before the cell transformation of fluid, transformation of fluid, that is protein-rich fluid exuded, as well as cellular movement. That is the Kali muriaticum stage. That is second stage of inflammation. Before going to the second stage, the stage appears to be over there, aconite followed by Ferrum Phos, followed by belladonna, followed by geranium, then the Kali muriaticum, where the exudation state comes. Exudation is plastic exudate. If you read the Kali muriaticum from Schussler's, he has mentioned second stage of inflammation where there is a plastic exudate. In each and every, if it is ear, it is plastic exudate comes from the ear. If there is a nose, nasal affections, the plastic exudate comes from the nose. So all discharges which contains plastic variety of exudate is the Kali muriaticum stage. Kalimur is very close to the pulsatilla. Kalimur is called to be a chemical analog of pulsatilla. Kalimur and Kalisol both are the chemical analogs to the pulsatilla. So that before that stage, Ferrum Phos is the remedy. Especially for catarrhal affections of the respiratory tract. This is common affections of the respiratory tract. This remedy is a wonderful remedy. Ferrum Phos 3x increases hemoglobin. That is the clinical significance he has mentioned, but it is not alone Ferrum Phos. Along with Ferrum Phos, it requires the Scalcaria Phos as well as Natrium muriaticum. If you give, yes, plastic means transparent, very correct. If you give these three remedies in a separate manner, they works, and they works definitely. But if you give Ferrum Phos alone, no, you will not going to get increased hemoglobin over there. So we have to understand the whole pathophysiological processes, and then if we administer the remedy, we get very wonderful results. In pale, anemic subjects with violent local congestions. So patient is pale, but congestion is violent. Hemorrhages bright red from any orifice. Wherever there are hemorrhages, there are bright red hemorrhages from every orifice. Now we'll just read the italics from rest of the particulars. In the head, he has mentioned headache better by cold application. So in general, Ferrum Phos is a hot remedy. In general, Ferrum Phos itself feels better by cold application. Everywhere, Prasuna, this is applicable in everywhere. This sequence is everywhere. It is not only for febrile condition. Everywhere, these inflammatory stages are very important to understand. Hyperemia of the optic disc in eyes, ears. Again, the first stage of inflammation. There is acute otitis. Nose, epistaxis, bright red blood. In face, the flushed face with cheeks sore and hot. Throat complaints. He has mentioned over there first stage of diphtheria, ranula in vascular sanguine constitutions, eustachian tubes are inflamed, stomach, vomiting of undigestible food, sour irritations, gastritis because of it is always there is an aversion to meat and milk. That is a typical characteristic of this remedy. First stage of peritonitis, first stage of dysentery. See, everywhere you're going to get same thing. In urinary also there is a diurnal enuresis. So daytime as well as at night time, involuntary urination used to happen. Females vaginismus, this is a remedy. Respiratory first stage of all inflammatory affections of respiratory tract with hemoptysis, expectation of pure blood in pneumonia. Heart, the pulse is short, quick, rapid, soft pulse, first stage of cardiac diseases. Extremities, articular rheumatism, rheumatic pains in shoulders. Sleep is restless, patient is sleepless, night sweats of anemia. One important thing is that fever, chill daily at 1 p.m. Very typical modality, time modality. Chill at 1 p.m. Very characteristic. All catarrhal inflammatory fevers, first stage. Modalities, general modalities, worse at night. Again, worse between 4 to 6 a.m. That is again a time modality with Ferrum Phosphoricum. Aggravation by touch, aggravation by jar, aggravation by motion, aggravation on right side, and better by cold application. That is the general modality. In general, patient is hot, feels better by cold application. See the relationship, compare oxygenate constitution. See remedies which he has mentioned for oxygenate constitution is aconite, China, arsenic, graphites, petroleum. These are the remedies which he has mentioned regarding the oxygenate constitution. Ferrum Phos is one of them. There in Ferrum Phosphoricum, there is congestion of brain and headache following great loss of blood, tarsal cysts. Aconite, gelsemium, and China. These are the remedies which comes closer. And I have seen, it's explained you the sequence. Aconite is early stage, then the Ferrum Phos, then belladonna, and then gelsemium. China is here he has compared for the intermittent fevers, even loss of vital fluids. China is the remedy. Ferrum Phos can be compared. Dose he has mentioned 3rd to 12 potency, but my suggestion to all of you, if it is not constitutional for the patient, and if you are using on the basis of pathological condition or clinical condition, better is always 6 potency. And second important thing, you can repeat it safely. You can repeat it many times. Very important remedy, and safely you can repeat. And it is wonderful remedy to prevent or stop the illness at the start only. So my all patients have this remedy with them for every complaint, and they know. They said I have written over there. कुठल्याही आजाराची सुरुवात. That is the only indication written on the bottle, and they ask doctor that remedy we want. कुठल्याही आजाराची सुरुवात. That's all. It is a wonderful remedy in such types of cases, and patient feels free when they have this remedy in hand in their pocket, so that it helps them anytime. So that's all regarding the Ferrum Phosphoricum from the Boric's Materia Medica. Already the Susla's Materia Medica, we have discussed this remedy. So my suggestion, go over there, read that again so that it becomes very fixed in your mind, and then read this remedy from the other books. But first, understand the core of the remedy. First stage of inflammation, oxygenoid constitution, tuberculosis first stage, tubercular miasm, and very important ingredient in the formation of hemoglobin molecule. This remedy is wonderful remedy in first stage of inflammation, where the stages are aconite, Ferrum Phos, belladonna, and gelsemium. So if you keep this in your mind, that's all for today. And then we'll have another remedy in tomorrow's session, and we'll learn thereafter about clinical aspects of other remedy. So any query is there? Yes, I have explained it, potency Rashi. It is 6-6 potency I used to use. If Ferrum Phos is constitutional, then you go for centesimal. Otherwise, no need centesimal. Any other question, query? So that's
Hello,
all
sir.
for, yes.
Sir, if there is a patient with acute exacerbation of the chronic complaints like joint pains, like gout or arthritis, is there any role of Ferrum Phos in that cases?
If it is the inflammatory stage which is so acute, if it is a acute, in gout happens, generally gout never comes like this. Gout comes with a fully blown inflammation. Acute state of gout, you never get such Ferrum Phos stage. You get like a belladonna state, because all signs of inflammation you can see in acute gout. So better remedy is always belladonna over there. Many times you require Ferrum Phos, Kalimur together over there.
Okay. Okay,
There
thank
was
you,
one
sir.
question asked that which are combinations of remedies including Ferrum Phos? Ferrum Phos, Calcarea Phos, and Natrium.
Hello, sir.
Now,
Sir, if constitutionally you have to prescribe Ferrum Phos, then which जे आपण मेंटल्स पण बघायला हवेत का फिजिकल जनरल्स वर पण आपण त्याला कॉन्स्टिट्युशनल रेमेडी म्हणून प्रिस्क्राईब करू शकतो
all
किंवा
things
और
which
फेरम
have
फॉसचे असे कोणते स्ट्रॉंग मेंटल्स आहेत?
Ferrum Phos remedy, it is not a remedy which is proved more at the mental level. Whenever when one has to think a synthetic prescription of Ferrum and Phosphoricum. It is a synthetic prescription, mind which is not thoroughly explained over there in the provings. So when you are thinking, so it very occasionally comes as a constitutional remedy, because it is a remedy which is proved up to this level more at the physical level than the mental level. So once in a while, I have used Ferrum Phos 30, 200 in few patients, very few patients. Otherwise, I would have used it in 6-6 potency because it works at that specific level. Synthetic prescription, you get the Ferrum metallicum along with the phosphorus aspect of the case. Then you can combine it and give the prescription Ferrum Phosphoricum. That is called a synthetic prescription, and you can utilize that if you feel.
Thank you, sir.
Okay. In fever, same dose, 6-6 potency repeated. So that's all for today. Thank you being there. We'll meet tomorrow again with the next remedy. Thanks a lot and good night.
Thank you, sir. Good night.
Good night.